thanks everybody for coming. We'll use our best loud voices. Hopefully you can hear all the way in the back because it's pretty noisy back here. But we're incredibly excited to be here today. We're going to talk a little bit about the CMS Health Tech ecosystem, conversational AI, and the pledge that was taken and where some of the progress is today. So just by way of background, and I'm going to introduce my colleague here in just a moment, but health happens every day. And not just in what we talk about in interoperability, which is really what the Health Tech Pledge is about, because the average person actually goes to the doctor only 2.4 times per year. So all of the decades-long work around interoperability and making things talk to each other from a payer and a provider standpoint is on average only 2.4 instances in a human's life in any given year. But when we think about the power of technology, especially now with LLMs and AI and having the ability to have a customized agent in your pocket, we can start to get outside of just healthcare and get into health. And that's wearables and sensors and smart homes and social determinants and goals and preferences and weight, as well as nutrition and things that we can really start to get to. But personalizing that information from a contextual perspective is incredibly important in order to build trust. And we're going to talk a lot about trust on our panel today. So when we think about what happens during the times when someone has no healthcare interaction, how do they prepare for an upcoming visit? Because as you know, historically, when patients go to a doctor, they get labs ordered and then they get their results, but they don't often have another visit or an encounter unless something's wrong. Where now you can actually start to prepare people for the questions and even the types of labs that they can start to ask to be drawn pertaining to their own health, with the premise that by giving transparent information to direct to consumers and caregivers, that they will make better healthcare decisions. And so transparency is exactly what the health tech ecosystem is continuing to advance on. It is not something that is new. It is something that is a building block on top of the work that's been done for the last 3 decades in interoperability. And it really just levels the floor of technology, including what data must be exchanged, under what permitted use cases, and opens the door to conversational AI or health assistance for every consumer in their pocket. So what is the interoperability framework? The framework is basically a leveling up of technology where new CMS-aligned networks will start to emerge. There are 21 companies who have pledged to be CMS-aligned networks, and that means that they must be on FHIR, the Fast Healthcare Interoperability Resource. Most data exchange today does not happen on FHIR, but this is something that the government has been pushing everyone towards for a number of reasons, not just because it's an open API, newer technology standard, but because the data that transacts on FHIR is more complete from a medical record standpoint, from a payer standpoint, so you can get more information, which includes things like physician care plans, structured data, unstructured data, so progress notes, clinical notes. But you must also make sure that you are not tethering individuals to a portal. So I like to say portalitis is the diagnosis we can eradicate in our lifetimes. I am here for it. We are going to do it. We're going to finish it. And so by allowing people to use modernized identity, like Clear, like you would see at the airport, right, or ID.me, and be able to go through it, a more verifiable identity practice, that we can more securely gain access to information in a more frictionless manner. And so this actually says that you cannot tether people to a portal or even require an individual to have a portal account in order to access their records. This is huge because 75% of patients who want access to their healthcare data drop off when they're asked to log in. And as a gating factor to data, it really doesn't work. I have a child with rare disease who was, a pediatric patient for a long time who's now an adult. If she goes back to her pediatric records and asks for a portal account, what do you think they're going to tell her? Do you have an appointment? She's going to say no. They're going to say, well, can we make you an appointment? She's going to say, you're not going to see me because I'm an adult now and I have a different doctor, but I need a portal account to access my data. It just doesn't work. And so we had to level up and get a better mechanism in place. And the good news is the technology exists. This is a forcing function to adoption. Although it is a voluntary framework, some of the largest healthcare logos that you and I have all heard of are all pledged to participate and to get this technology bar live this year. So it is moving at a sense of urgency that we've never seen before. So on top of these new networks that are going to transact data with a must share to patients, let's get a big hallelujah back there. There are 3 use cases that companies have also pledged onto. The first one, kill the clipboard, is actually moving from data access to data portability. So on your phones, as early as next year, you will be able to have a QR code that is going to be a cryptographically signed package of your digital health card, your insurance information, your longitudinal health record using a minimum of US CDI v3, which is just the amount of data that gets transacted. And what we're pushing for at b.well, something called the International Patient Summary. So a physician can have a snapshot of your health that they can see exactly where the information came from. And a patient will be able to, upon digital check-in, pass that information to the doctor that they're seeing, even if it's the first time that they're seeing them. And this technology standard works, it lives, and after this, we'll walk you over to where you can see a demo of that. Diabetes, obesity, and prevention management, because this is a condition that costs our country a ton of money, and the average person, by the time they age into Medicare, already has one or more preventable chronic diseases, and this is one that the government has asked companies to come in to exchange data to try to solve for. But the other one that we're going to highlight today, conversational AI assistance. And here I'm going to introduce my guest, but effectively the government has said, we would really like for all patients to have a personal health AI agent and context around their medical data. Because any one of you who's ever seen your medical record or your payer record, it's codified. It's not something that's meant for human consumption, and certainly not at any type of fourth grade reading level or in multiple languages. So these conversational AI agents are meant to unlock the power of getting more transparent information and context to the patients that companies serve. So with us today is one of the other pledged organizations in the area of conversational AI. So if you guys would help me welcome Farid to the table, or to, I guess, the mini stage, to tell us a little more. So Farid, tell us, why did you pledge? What does your company do? And tell us a little bit about the problem you're solving.
Yeah, absolutely. So everyone, my name's Farid Vij, co-founder, CEO at Citizen Health. And Kristen talked about a really important thing, which is context. So we focus on rare disease. Kristen has lived that experience herself. The average patient on our platform is seen at 9 different providers concurrently. 70% of rare diseases impact kids. And so you have the entire family that's engaged. They don't go to the doctor 2.4 times a year. They go to the doctor about 20 times as much as that, but still 99% of care happens outside of the care setting. It happens at home. And these patients, they don't have a choice. They actually do know their data. They often know more about what's happening with their child than the doctor does. But they don't have an interest in sitting there and reading their portals and reading their medical records. And so how do you put something in their pocket where you can democratize advocacy for that individual, because they understand your context, they understand your longitudinal medical history, and because it has taken so long for data interoperability and a lot of the work that you've been driving to finally come online, when we started working on this years ago, we just used a HIPAA provision of right of access, and we used to get boxes of paper, and we used to get PDFs that are thousands of pages long, and we built the technology to be able to read that. And in June of this year, we launched the AI Advocate, which is our main product, where patients have a conversational assistant that interfaces with their health records, allows them to actually understand context from other people who have consented their data as well, because they want to know what medications has worked, what doctors are you seeing, because in these rare diseases, there's very little information out there. There's very little known. So when the CMS pledge came about, and we had the opportunity to pledge there, we thought, well, we're already building this, so it probably makes sense for us to really, be part of that conversation. And I think it's one of the most, we were talking about this earlier. I've been in the space 10 years, and like every 3 to 4 years, you see some new personal health records apps pop up. If you walk this floor, you'll see 3 or 4 new ones. And I think for the first time, because of these conversational assistants, they're actually going to take. But a huge part of it is going to be, I don't think there's going to be one. I think the reason that they're asking lots of companies to do this is healthcare is vertical. Healthcare is not horizontal. So it's not just about pulling the data, it's all of the context that you can put around it. And I think that's really what the opportunity is here.
Well, I'll tell you that when my daughter goes to see and gets referred to a new physician, and she sits down and the first thing they say is, tell me what's going on. She just goes, Mom, because she doesn't want to have to go through her whole story. So it becomes significantly more impactful for people who can provide help to these patients to push the right level of information in advance and also to contextualize that information. So what you heard my friend Farid say is something that I think is so critical, which is how can I interact with my medical record to get information? But more importantly, how can I interact with other people like me? And my daughter says, if one more person walks up to me and tells me how unique I am, she's like, Mom, I want to punch them in the throat. And I'm like, you're a teenager. I get that feeling. But now let's talk a little bit about AI, right? Because especially in the case of, my daughter and the patients that Farid's team cares for, is they don't have a small number of medical records. Their medical records are the top 1%. They have more data flowing that it takes hours to get their longitudinal health information, where for the average person, it can come in less than 2 minutes. So when we think about AI and we think about data, and especially patients who are for the first time seeing their data, we know there's bad data in those records. So talk a little bit about how can you make sure that when they're interacting with their medical record that they're getting accurate AI, because I think we've all heard the concerns around hallucination and error. So talk to us about that.
Yeah, absolutely. So we spend a lot of time on this. Now, everyone gets really excited about AI because you can give it personality and you can make it empathetic and you can do all these things. If you want to understand how the underlying technology works, it works exactly like a human brain does. So what happens when you are asking a question to someone and putting a lot of pressure on them and forcing them to answer in a particular way? They sometimes make up an answer, or they sometimes lie, or they sometimes hallucinate. So we focus on three things. One is that anything that the AI ever tells you has to be grounded in like underlying medical records. There has to be data provenance where anything it says, we call it citation or silence. So we're either going to be able to cite exactly where we pulled it from. You're going to be able to see that exact note or wherever that consult visit, wherever that is, that information is coming from, so that you as a patient can verify and get broader context around it. The second is we allow patients to actually be able to flag where they do see discrepancies. So we see this in medical records all the time. I'm going to give a cancer example where we have patients that will literally have in one note saying that they're BRCA positive, and then there'll be a genetic test that says they're BRCA negative. And so the AI is going to tell you both of those things. It's not going to fix that for you. And that's the approach that we take. The third thing is we never give medical advice. So I think there could be a whole nother panel on AI doctors and what both of us might think about that. I think there's a lot of promise there, but it's always in co-pilot mode. So you always want a human there. And I think if you look at some of the governance regulations, some of the stuff out of CMS, one thing they've said is, hey, we always want the human involved. We don't want the AI to sort of go off and be doing the work on behalf of it. So those are sort of the three things that we've looked at, which is how do you make sure that there's data provenance for every single thing? How do you make sure you're not providing medical advice? And how do you give users the ability to annotate or actually tell the AI when something is off, which we built it so it'll remember that the next time, and you can start to build that memory over time as well.
Yeah, we talk about memories all the time. Anybody who's really developing an AI will tell you that, especially with the history of a patient, is that you're building memories for people. And so one of the things that we've put forward in our own application is something we call the Patient Bill of Rights. So you should be able to see transparently what are the memories that are being created about you that are training your conversational AI agents, and being able to tag one of those memories as false. And that's important, especially in this era of coding, and in many cases upcoding, right? You might have somebody who looks like they're diabetic because on the payer side of the world, they've been flagged as diabetic multiple times when really they were just being screened for diabetes. And that happens today. So if your AI agent thinks that you're diabetic, and you know that you're not diabetic and you don't take medication or even see the right kind of doctor, it will skew the conversation for you in the future. And so being able to provide transparency is really important to building trust. So I use the big T word, trust. Now, there's a little debate going on around, should we use AI? Should we not use AI? Can it be trusted? And I will tell you that any foundational LLM will tell you that 15 to 30% of queries every day are health or healthcare related. So whether we as an industry like it or not, it's here, and they are trusting technology to give them better questions and contextual answers, prepare them for doctor's appointments. So talk about how you can build trust when you are putting forward these conversational AI assistants, because that's what the administration is going to be looking for in the early demonstrations.
Yeah. And I think when we think about trust, it's not just the stuff we were talking about of how do you build the AI so that it can be trusted? How do you do, the things I talked about? It's how do you actually bring the provider into the mix as well? Because whether they want it or not, patients are going to be walking in and they're going to be saying, they already are, I'm a self-professed hypochondriac. I don't have a rare disease, but every week I think I have something new. And so I drive my doctor nuts because I will go on ChatGPT and I will spend a lot of time on it and I'll send them a bunch of stuff. And the only thing you'll find in my medical records is a lot of notes about how I'm a hypochondriac and probably don't take this patient seriously. But for people that are actually sick, a big part of that trust, like we have patients that they will take our app into appointments. They will be querying stuff on the fly with the doctor, and they're showing it to the doctor to say, look, this is where I'm pulling my information from. This is where I can get information from other people with my disease as well. And I think that's going to be a really important piece of, I don't think trust in the sense of like, how do we get the AI to be trusted? I think that is a solvable problem, and we're going to continue to be able to solve that. But as you know, you can put lots of policies in place, whether it's our data interoperability or other things. How do you get people to actually participate? How do you make sure that providers are not going to be pushing back and coming up with excuses for why they don't want to trust the stuff, which means that even if the patient has it, it's not actually going to do the thing for them that they want if the person who's caring for them doesn't trust it as well. So I think a big piece of it is like a lot of these conversational AI assistants, a lot of what we think about is not just what does the patient need, but when they're in a care setting or when they're sharing something with a doctor, how is that information presented? What is the context around that information? And how do you get the provider to actually lean into wanting to actually leverage that? And we have multiple providers who have asked our patients, where did you get that? And is there a provider version of it? That is the narrative that we want to be able to build. So I think of trust not just in terms of the technical pieces and sort of the governance around it, but how do you actually build adoption, with everyone involved when it comes to that day-to-day care?
And one of the things that I think, is helpful for those of you who are just starting on your AI journey, one of the things that we learned really early on is that accessing data about a person is not enough for accuracy, that it needs to be semantically interoperable. And what that means is, and many people don't realize this, there are 2,000 EHRs in this country. And every payer has its own system set up and configured uniquely to them. And they all code medical records and clinical information differently. And so having a semantic interoperability layer on top of the data that you're accessing actually improves the accuracy of your AI significantly. But with that, I am going to ask Farid one last fire shot question, because it's one that I really care about and why I'm so excited about the work that they're doing, and honored to be able to power that with interoperable solutions. But the one question my daughter turns and asks to me all the time is, Mom, why is there no one else like me? Because she's an unnamed N of 1 rare disease. And some of the work that Citizen is doing with their conversational AI and how they're consenting patients could for the first time give her an answer that, based on data and information, she may not actually be alone. So talk to me about that.
So I think this is probably the most powerful thing about what we are building. And think about any context in your life, whether you're trying to figure out what restaurant to go to or whether you're dealing with a health condition, you want to talk to someone else who has walked in those steps before you have. You want to know what the crappy dish is or where the service was bad. You also want to know which treatment worked, which doctor had the right bedside manners, and where you found a center of excellence that could actually give you the right treatment and the right options. That information is always buried. And so if you imagine now, you have an agent in your pocket that knows you really well, knows everything about you, and only with your permission, it has to be with consent, it can go and talk to any other agent on the platform and say, hey, my patient or the person I'm helping is dealing with this issue, be able to pull information back in a de-identified and private way, be able to serve it back with two things in place. Verified identity. We know that you are the person you are, and we know that you have the similarities because we have your full medical record, and validated data. So not just something I posted on Facebook. By the way, Facebook does a lot of favors for these communities. It's good stuff there. But I don't actually know what's in the underlying medical records. I don't actually know what actually happened. And so if you pull those things together, I can now say I'm dealing with this new symptom, and within seconds, I will be told what other people like me have been through. I think of it as ways for healthcare, right? You can tell like which route you want to take and where there might be a pothole, a mile down the street. And eventually you can even connect with that individual to be able to get the richest experiential data that you want to decide what your next step is. And I think that's where all of healthcare is going.
Well, it's been awesome speed dating you all for the last 20 minutes. But if you'd like to see live working demos of these technologies and how far they've come, please do join us at the b.well booth. We have Citizens demo on display for you, as well as b.well's. And we'd love to talk to any of you who have more questions about the health tech ecosystem. Remember that it is a voluntary pledge. It is come one, come all. We want everyone in the community participating. So please, if you want to figure out how to get involved, come talk to us. We'd really, really love to see you and get you involved. So thanks so much for your time today.
Thank you.